Dear friends, I wholeheartedly welcome you all for this program. I am on Dr. Muthukumar. I am the International Admission Liaison for the Bay University that gives a medical MD degree recognized by the American Board Certification. And the people who are eligible for this one is a minimum pass of +2 alone. Very simple. Everybody, very well. We do not want any of the NEET results or marks. We do not want any of the entrance examination marks. We do not have any of the entrance examination result. No IELTS, nothing. The mere pass will do for our to get admitted in our Bay University. So already 2 batches are gone. Our university is a WHO recognized university. We already got recognition from Medical Council of India. So everywhere all the formalities are over. So far 2 batches are already they are learning, and this is our 3rd batch recruitment for which we are closing it by September 30th. That is the reason I am coming before you to tell you till September 30th the gates are wide open. Kindly make use of this wonderful opportunity. I want to emphasize one little thing, how we differ from all the other people who are coming out with overseas education. I want to make it very clear, we are little different. Not only little different, we are totally different. In what sense? Only when you join our university alone, you are entitled to go and learn your clinical rotation in US. All other colleges, they are coming out from Philippines and China, Russia, Georgia and St. Lucia, something else, all Western Caribbean islands. Then again from European countries, whatever be that, you can read USMLE syllabus, but you will not be entitled to enter into US to do your clinical rotation, that is the 4th year and 5th year. Last 2 years study, you have to have only in America to get an USMLE recognized MD degree course. All other things are, you can go, that alone they will tell. But actually, I tell you, unless you do the practical, that is a clinical session, clinical rotation in US, you will not be allowed to enter into America to work there. So this is what is an option. Once you complete the USMLE Part 2, that is after completing the MD, as a final exam, you have to write the USMLE Part 2. After completing the USMLE Part 2, automatically you hear how we do house science, there you will do senior internship. That you can do that for 5 years. Government is allowing you to go for 5 years. And they pay per month with a salary, that is a stipend of 3 lakhs per month. And it will be more than enough for you because you are going to stay in the hospital and you are going to take the food from there, which will be very lesser income. So lesser expenditure, that's what I mean. So this is what is all about. So after that you can write the Part 3. Once you complete the Part 3, you will become a qualified man. After completing MBBS, if you want to go to government job, what you do? You apply for TNPSC, that is the Public Service Commission. Likewise, there you got a board. The board exam, only the USMLE Part 1 is the toughest out of among all the 4 exams. Once you complete that one within a 1 year period, finish, you will be given a doctor job in USA, any of the 50 states of USA, within 21 days. You can go and check it in the Google. You know the payment, how much they pay for the orthopedician and the cardiologist. The government of America, it pays $500,000 US per year. That comes to nearly 3.75 crore per year. So for 365 days, 375 lakhs. So per day, you can earn 1 lakh. No exaggeration, no gimmicks. You can very much go and refer this in any of the Google. It will tell you everything. This is the finest opportunity which we give to the Indian students. Because I was not given this opportunity. In our time, when we were in 1978, when I came out of MBBS, we all tried to get into this America, but it was completely a nightmare for us. So if 100 people appear, only 2 people will get passed. The reason being is our syllabus is entirely different, their syllabus is entirely different. Learning in one syllabus and appearing exam for another syllabus, absolutely it's not an easy job. That alone is difficult. Not that the USMLE subject is difficult. Don't believe it. USMLE subject is also very simple. Those who can take 50 to 60 marks in India, easily they can go through USMLE Part 1. So at this juncture, I would like to give an invitation. So what is the reason is, first year, second year, first batch and second batch, we had limited numbers. The reason being is Corona was there. Now because it has been lifted up, thank God, I should be very thankful to the parents who have had trust in us and who made them to admit in our university. I am very happy. So much seats are filled up. So 30th of September, we are closing down the whole show. So kindly make it a point. Those who want to avail the opportunities, kindly contact me in the number given below. This is one thing. Now openly, I give an open invitation to all the students who came down from Ukraine. So from Ukraine students, I request you, I tell you, our doors are open wide for you to come and join with us. If you complete your first year, you can come and join in the second year. If you complete the second year, you can come and join in third year. But after third year, fourth year, fifth year, any amount you have completed, you have to come and join only in the third year. The reason being is, you have to complete USMLE Part 1, which is held at the end of the third year. So for the 1 year, we have to prepare you to face the examination USMLE Part 1. Then only you will be entitled to get into US to do the clinical rotation, 4th and 5th year. So you have to keep it in mind. So I wholeheartedly welcome you, but only 2 requests I want. What are the 2 certificates I require out of you? Number 1 is the recognition letter from the government of Ukraine towards the university in which you have got the degree. That is very important. Maybe first year, second year, okay, not degree, first year, second year, okay, it's okay. But I need the government recognition, number 1. Number 2, you take it from me, I want the credential certificate. You know very well, those places they will give credentials, marks, something like that they will give. I want the credential certificate. Both of them, if I see that on physically, then you will be given an opportunity. So kindly make use of this opportunity. And people living in Karnataka, Andhra, and here in Pondicherry, in other area, I request you, I tell you, I repeatedly, I assure you, we are not the normal people as others. We are little different. Kindly ask somebody when they approach you for studying abroad, you ask them, where are you going to conduct the 4th year and 5th year clinical rotation? If they say it is in US, kindly join with them. That is exclusively correct. Clinical rotation, you ask only one question, where my student is going to have the clinical rotation, that is the 4th year and 5th year. If they say within US, yes, that is okay. All the things are nice, they are good, they are genuine, but it is not like our degree. Ours is MD given by American Board Certification. That alone is recognized everywhere. I am an MD since some years. If I move out of India, say for Sri Lanka, I have to be there to work there for 2 years. This is the value of the Indian MD. So likewise, what you have to do that is, here in America, the degree given by the American Board Certifications recognized worldwide, including India. This is what I am repeatedly telling you. If you don't want to practice in the US, pretty much you can come back to India. In India, you will be given the same MD degree you are considered. But one thing, when you move from one country to another country, any country will have an examination for you to get through. That you have to do. But because you have been taught in USMLE syllabus, and because the system in India is something lesser in quality, easily anybody can come through and get through. That is the only thing. If 10 doctors from India, in the name of MD, they appear, in your name, within bracket, MD within bracket, if you put AB, you will be given the preference. That is a betterment and that is a beneficial which one enjoys because doing the MD in American Board Certification. So I welcome you all. We are closing down on September 30th and this is going to be one of the nice opportunity for you. And with this, if you want to have any doubt, clarification, feel free to contact me in the number that is given below. I'm always at your service. God bless. Thank you so much. Nice.